Welcome to the GOTA Nerve Test Quiz. Phalanx maneuver is also called the wrist flexion test. To complete this maneuver, you place the backs of your hands and fingers together with your wrists flexed and your fingers pointed down. You remain this way for 1 to 2 minutes. If you have a positive phalanx maneuver, you likely have what condition? If you have a positive phalanx maneuver, you likely have carpal tunnel syndrome. Another test for carpal tunnel syndrome involves the clinician tapping or pressing on the median nerve in the patient's wrist with a flexion hammer. What is this test called? Tinel sign. Several provocative tests can be used to determine if a patient has rotator cuff involvement. Name at least 4 of these tests. There are several provocative tests for rotator cuff involvement, including Apley's scratch test, Mears sign, Hawkins test, drop arm test, the cross arm test, Sperling's test, apprehension test, relocation test, Sulca sign, Yergas test, Speed's maneuver, and Clunk sign. Name the nerve test which involves the patient attempting to touch the opposite scapula to test the range of motion to the shoulder by reaching above their head for abduction and external rotation by reaching to their scapula with their arm down to test adduction and internal rotation. The Apley scratch test involves the patient attempting to touch the opposite scapula to test the range of motion of the shoulder by reaching above their head for abduction and external rotation by reaching to their scapula with their arm down to test adduction and internal rotation. The Liftoff test requires that the patient rest the dorsum of the hand on the back lumbar region and reach away from their body. If the patient cannot get into the testing position or is unable to lift, what aspect of the rotator cuff is involved? The Liftoff test requires the patient to rest the dorsum of the hand on the back of the lumbar region and lift away from the body. If the patient cannot get into testing position or is unable to lift, the subscapularis muscle is involved. You complete the Hawkins test on a patient. You position them in forward flexion of the shoulder at 90 degrees and complete internal rotation. If the patient has a positive Hawkins test, they have pain. What tendon is getting impinged? If a patient has a positive Hawkins test, all structures located between the greater tubercle of the humerus and the coracohumeral ligament are experiencing impingement. The upper limb tension tests are also known as the brachial plexus tension or the Elvery test. What are the main purposes of the upper limb tension tests? The main purpose of the upper limb tension test is to check for peripheral nerve compression as part of the neurodynamic assessment. It can also be used as a therapeutic intervention as nerve flossing or nerve glides.